Hello. Medical errors are preventable, but not the way you think. That is the topic of this presentation. The healthcare policies without proper digital logistics is a no-win when it comes to medical error prevention. Caregivers have the power to prevent medical errors because personal touch is their duty. As physicians, we need to maintain our connection within the medical practice with everyone. Doctors make mistakes in their personal or professional endeavors, like everyone else. Likewise, medical error history stretches back as long as the existence of the medical profession. Thus, we should always underscore that medical errors will potentially happen. Medical errors happen for preventable reasons. As the workflow of the medical profession becomes more complex, we should anticipate medical mistakes. Failing to execute or complete a planned effort in a patient's care often does not end up injuring the patient. However, even one medical error ending in patient harm is enough to change patients' lives and the doctor's professional dynamism in the opposite direction. There are limitless reasons why medical errors happen. Nevertheless, poor communication is the most prominent and well-recognized basis for medical mistakes. Whether one can point to the lack of adequate communication between the medical team or utterly as the upshot of the poor doctor-patient relationship, one fact remains shared amongst all. Someone utterly dropped the ball on performing a task they were supposed to complete. Preventing medical errors involves taking responsibility, shared effort, and transparency. In other words, to avoid mistakes, everyone in patient care, including patients, must learn to be willing to articulate any questions and concerns to prevent medical errors. They must ensure all health professionals on the team have access to the patient's health information. One can never underestimate the role of risky behaviors as the precipitator of medical error. The behaviors include engaging in a grab-and-go attitude with prescribed medication without thoroughly reading the label before it is dispensed or administered. Other risky behaviors include reluctance to ask for help or clarification, failure to educate patients, negligence to double-check high-alert medications before issuing or nursing, and failure to communicate important information like patient allergies, diagnosis, and medical history. One can find many policies and procedures around medical error prevention, from establishing transparency and gatekeeping procedures to various forms of accountability. Almost all healthcare leaders are on the same page on reducing circumstances and behaviors that can potentially result in medical error transpiration. But, amongst all, there are two options to work on to prevent medical errors: transparency and collaboration. Almost all the preventative measures against medical error mentioned earlier necessitate an environment where every player involved in the care of the patients can seamlessly communicate and collaborate in real time. Furthermore, as healthcare leaders are expanding the medical point-of-care system from healthcare facilities to remote locations, the need for fundamental infrastructural reform is also becoming inevitable. The Medical Error Prevention Campaign demands new digital logistics to guarantee transparency, real-time collaboration, and a hybrid work model. The new solution I foresee is a cyber community or city with all the amenities and gadgets for patients and healthcare professionals in their care to realize, exchange, teach and learn to engage and treat every patient. Modern digital logistics is a cyber-physical human network of sensors, computer algorithms, and human resources. If one human or technology misses detecting a medical error, someone or some technology can see and avert preventable obstacles. Thank you for listening. You may find the original article for this presentation by visiting Medium.